which is good, okay? And they also get to use their other leg to help get the leg back up to where it needs to be, and I'll explain it in a second. So what we're going to do is we're going to take a towel behind the heel. She's going to put the towel right behind the heel. We're going to work passively on range of motion and deflection. When you have a knee surgery, it's not going to flex the knee very well. Okay? So what are we trying to do? We're trying to increase range of motion of the knee. Okay, so we're going to have the knee slightly bent. We're going to pull this right like this. Put this underneath the heel. And she's going to grab either side, and she's just going to pull her knee as far as she can pull it in deflection. Now, it's a TheraBand. It's not going to work as good as a towel, right? Okay? She's going to pull that knee all the way up into flexion. Get that range of motion. Okay? Wall slides. Same exact concept is that they're laying on their back and their feet are on the walls. Okay? The good leg is going to support the bad leg. And what we're going to do is we're going to straighten the leg all the way out and we're going to let that foot slide down on its sock to get that full range of motion. At the end, if we want a little bit of overpressure, we just take that other foot, put it on top, and push down just a little bit to get a little overpressure. The knee's too weak to go back up to the top of the wall, so the other leg has to help back up. All we're doing is wall slides. Our foot is sliding down the wall to increase range of motion in the knee.
I can't picture that. You have her like fake a wall.
Fake a wall. So the foot, here's the wall. Basically, this leg's going to help support and not let it drop. Okay, and she's going to slide down the wall. Once she gets to her in range, she can put a little overpressure. And then she's going to help that leg back up. Okay? Any questions about that one? So those are the two passive things that we could actually do to increase range of motion to help get that range of motion back in the knee. Okay? Without a doctor sitting here going like this. Okay? And finding that end range. The patient can do it at home, and we're going to give them these home exercises religiously. How many people in here have had an ACL repair?